Good morning, everyone. We're going to get started in just a moment, so I'd like to ask you to take your seats. So again, good morning. I'm Mark McClellan. I'm the Director of the Initiatives on Value and Innovation in Healthcare here at the Engelberg Center at the Brookings Institution. I'd like to welcome you all today. Many of you all have participated in previous events that are part of the Richard Merkin Initiative on Payment Reform and Clinical Leadership, which is our flagship initiative on combining healthcare reform and leadership by clinicians. This initiative recognizes the potential for doctors, nurses, pharmacists, medical assistants, and other health professionals working with their patients to lead needed reforms in our healthcare system. We're focusing on reforms that change the way that healthcare is delivered to improve health and lower costs at the same time. This includes an emphasis on prevention, on more effective and efficient care for chronic diseases, on coordinating care more effectively, and on better patient-focused support using new technologies like wireless access and internet-based technologies and systems. In all of these areas, there continue to be big gaps between the care that's currently delivered to Americans and what could truly be high-value health care. Health professionals have unique knowledge and technical skills to identify and implement these many ways to improve care. And I know from talking and working with many of them, they see ideas every day that could help improve care for their patients. They also have unique trust, unique relationships with their patients that enable them to help find ways to implement these kinds of reforms. After all, without the trust of patients, without the belief that Americans can get the care they need, even with the implementation of reforms, no reform is going to succeed. It's that patient trust, and nobody has patient trust like health professionals. So much of our effort in the Merkin Initiative is focused on identifying ways to reform payments, reform our healthcare financing systems to make it easier for clinicians to get the support they need to improve care. This includes ideas on alternatives to the Medicare Sustainable Growth Rate, SGR, physician payment system, and other payment reforms that call on clinicians to lead. We'll have more to say about financing reforms like alternatives to the SGR in future events and publications. But while changing the way that we pay for healthcare is critical for supporting real reforms in care, also critical is the engagement of clinicians and their patients in leading the way on needed reforms in financing and in the delivery of care. So this is different than just focusing on the payment reforms, but it's an essential part of effective healthcare reform, especially in an era of new media and new means and opportunities for broad engagement and public participation and leadership in healthcare reform. The vision of this core component of the Merkin Initiative is to create new opportunities for the exchange of ideas about how to reform care to improve health and lower costs, and how to reform care and the financing of that care to support needed changes in delivery, to provide innovative and easy ways to share key learnings and experiences on clinician leadership in healthcare reform, to enable clinicians working with their patients to lead healthcare reform. We're going to utilize a number of means of engaging clinicians and their patients in healthcare reform activities through traditional media, including new uses of traditional media, social media, massive online open courses or MOOCs to help health professionals and the public be not only better informed, but better engaged, more effective in shaping real healthcare reform. To provide an overview of today's events and to introduce these new steps in the Merkin Initiative on Payment Reform and Clinical Leadership, I'd like to introduce Dr. Darshak Sanghavi, a pediatric cardiologist and Merkin Fellow and a relatively new addition to our team here at Brookings. Darshak?
So thanks very much for that nice introduction, Mark. Welcome to everybody on behalf of the entire Engelberg Center and the Merkin Initiative staff in particular. We're really, really pleased to have you here today, both in person and to those who are watching us on our live webcast as well. Again, thank you and welcome. I also would like to extend a special welcome to our expert panelists and thought leaders in a variety of areas that we're trying to engage today. Those involved in physician training, physician education, those involved in trying to explain policy, both to the physician community as well as to the broader public in ways that resonate with them. Those of you who are actually trying to do research in these areas and then also broadly disseminating that research to the appropriate audience. You've all convened together to discuss these issues, to sort of push these areas forward, and then also to help us celebrate the launch of several innovative initiatives that we've engaged in here at Brookings via the Merkin Initiative. So I was going to take a step back and say that I'm a clinician, I'm a pediatric cardiologist, and I can say that many physicians have great ideas on how to take care of patients. But one of the remarkable things I see, both in my day-to-day clinical work and even now that I'm something of a policy person here now, is that we simply don't understand or have the tools or the knowledge to always engage with health policy. And that is one of the themes that we will explore, and how to actually make that better and how to increase that productivity so that we can engage constructively. So I'd like to just go ahead and give you a brief overview of what the panels are that we'll be discussing today, and a little bit about what you can expect in our day with us today as well. So the first panel, and I'll let you read the panelists' bios in the packets you've seen already, really deals with physicians, physician educators, and practicing clinicians. As the frontline decision makers who directly influence the delivery and quality of care, clinicians play an important role in looking at the implementations of reforms in a very real way as we try to move towards a higher value healthcare system. And yet, many clinicians really would like to be more actively engaged in that policy discussion and that policy process. They're truly committed to improving care for their patients, making it higher value. And our first panel is going to sort of explore those issues in a way that also focuses on physician training, physician licensing, and how we continue to engage clinicians more broadly. Next, we'll move on to how do we then take this and explain it and put it in a form that most people can understand. And for that, we are going to have a very thoughtful panel on media. Those who work in television, broadcasting, print media, in ways to engage the broader public. This is sort of one of the things that everybody often talks about. Why don't we do a better job explaining all the stuff that's so important to the general population? And we'll explore that. Moving on, at that point, then we'll take some time to introduce one of the initiatives we're very excited about that just went live within the past 24 hours, which is a Brookings Institution collaboration with the Khan Academy. And we'll discuss that. And this is a way of bringing education about healthcare, health policy, delivery, and system reform to the general public, to clinicians, in a way, again, to engage them productively to making the system better for all of us. We'll then move on to social media. What is social media? How can it actually be used to enhance the communications and the relationships between all of us engaged in trying to make healthcare better? Again, a fascinating panel. And then we will explore another fascinating area, which is massive open online courses, or MOOCs, and take a page from the Harvard-MIT collaboration edX, and then discuss ways in which we at Brookings are going to try to leverage that type of platform to then go even farther into educating, engaging clinicians and the broader public in learning how do we actually make healthcare better in a very granular way. So with that as an introduction, I would like to go ahead and invite the members of our first panel up to the stage. To come on up. And I will just introduce them briefly by name. You can read their bios. Actually, I'll have maybe Dr. Bachner, would you like to come on up here first just to introduce the panelists? Howard Bachner is the editor of the Journal of the American Medical Association. He'll be moderating the first panel.